Hello everyone, welcome back to our channel Dentistry to the Point. This is Dr. Dhrumil Manek, and today we are going to start with a topic that is dry socket. So these are the headings which we are going to cover. That is, we'll first see the introduction, definitions, what are the signs and symptoms of dry sockets, what is the incidence, how is the onset and duration, what are the causes or etiology for that, what is the pathogenesis behind the occurrence of this disease or this condition, that is dry socket, what is the prophylactic management and symptomatic management, and lastly the discussion part. Starting first, dry socket is one of the most common complication that occurs after extraction of teeth. So whenever question is asked that what is the most common complication that occurs after the extraction of teeth, that is dry socket. So why are we going to study this topic? So we'll see various definitions, that how did they come up with this terminology, then discuss about the etiology and pathogenesis, as I said, the need for identification and what are the risk factors which are involved and how are you going to eliminate those risk factors, and lastly the preventive and symptomatic management of this condition. So what are the various names or synonyms or alternative names of dry socket? You can call it as alveolar osteitis or localized osteitis, that is a localized inflammation of bone or inflammation of bone. Post-operative alveolitis, that is after any minor operative surgery, there is inflammation of bone, alveolalgia, then alveolitis sicca dolorosa, then we have septic socket, then you have necrotic socket, then you have localized osteomyelitis, and lastly fibrinolytic alveolitis. Now, what does this fibrinolytic mean? That means there is degradation of fibrin, right? Whatever the clot is formed, that is going to get degraded. We'll discuss about this in detail in further part of this presentation. Moving on to the introduction, so it is one of the most common post-operative complications, as I said, following the extraction of permanent teeth, and this condition is collectively known as dry socket. This term was first been used in literature in 1896 and it was described by Crawford. So he was the first one who gave this term. There is one more most common name, but this name is not used very much popularly compared to dry socket, that is fibrinolytic alveolitis. As I said, it is the most accurate of all terms of dry socket. We saw 8 to 9 synonyms of dry socket, in which this name states the accurate pathogenesis or the activity of this condition, but it is also least used in the literature, as I said. In most cases, the more generic layman term is dry socket tends to be used, not layman term, but lay term. Next, the definition of this condition can be formulated as a descriptive definition that could be, we can give is that a post-operative pain in and around the extraction site. So whenever there is an extraction site, for example, this is your third molar and you have extracted this. So this is your extracted sites, right? So post-operative pain in and around the extraction site, which increases in severity. So the severity of pain is going to increase as the day increases, right? So severity at any time between 1 and 3 days after extraction is considered accompanied by a partially or totally disintegrated blood clot, right? So there will be disintegration of blood clot. You guys must be knowing that for any type of filling there is necessary for a formation of blood clot, right? So in this there is disintegration of blood clot. So for example, if there is disintegration of blood clot, there is going to be a delayed healing, right? The alveolar socket with or without halitosis, right? There is not a confirmatory thing that always there is going to be halitosis, but yeah, sometimes in some cases you will see halitosis. Next, moving on to the signs and symptoms. So the signs and symptoms states as the denuded alveolar bare bone may be painful and tender. So wherever your extraction site is, that alveolar bare bone is going to be painful and tender. Some patients may also complain of intense continuous pain. So after 1 to 3 days of extraction, also the patients, in spite of taking medication, he will complain of intense pain, which is going to radiate in the area of ears and neck sometimes also. Along with that, you will also see regional lymphadenopathy, that is enlargement of the regional lymph nodes with unpleasant taste. As I said, halitosis is also accompanied with that. You will see sometimes unpleasant taste. Trismus is a rare occurrence in mandibular third molar extraction, right? So sometimes you'll also find trismus when dry socket is associated with extraction of mandibular third molar. It can be due to lengthy or traumatic extraction caused by an oral surgeon. What is the incidence? 3 to 4% following routine dental extraction. So from 100 extractions, we can say that 3 to 4 extractions lead to formation of dry socket. Then we have 1% to 45% after the removal of mandibular third molar. So we can say that incidence of dry socket is most commonly associated with mandibular third molars. Next, 25 to 30% after removal of impacted mandibular third molar, right? So whenever there is involvement of impacted mandibular third molar, from 100 cases, there are 25 to 30 cases which are leading to dry socket. So from there we can see that mandibular third molar extraction is the most common site. It occurs 10 times more frequently following the removal of third molars than any other location. Next, moving on to the onset and duration of this condition. So mostly, as I've said before, it is going to be between 1 to 3 days after extraction. Sometimes it will be within a week in 95% and 100% of all cases of dry socket. When it will be within a week in 95% and 100% of all cases of dry socket. The duration of dry socket varies to some degree depending upon the severity of the disease. It is not necessary that every dry socket is going to lead to a same severe condition, right? It depends on pathophysiology, what are the factors involved and how many days, right? Next, moving on to the etiology. So etiology of dry socket is multifactorial. There is not a single factor which is associated with the etiology of dry socket. There are several factors like oral microorganisms, difficulty and trauma during surgery. As I said, that lengthy and traumatic surgeries. If during the removal of third molar or any other tooth there is remnant of root or bone fragment in the socket, then it can lead to dry socket. Excessive irrigation or curettage of alveolus after extraction. If you do excessive irrigation or curettage of bone, if there is physical dislodgement of clot, as I said, there is disintegration of clot, local blood perfusion and anesthesia due to decreased blood perfusion due to oral contraceptive and smoking. So what are, we'll study the various factors a little bit in lengthy form or detail. That is, oral microorganisms is the first one. So this is due to increased frequency of dry socket in patients with poor oral hygiene. Those who are having poor oral hygiene will have high content of oral microorganisms in their oral cavity. Along with that, pre-existing local infection is there. Then also like pericoronitis or any advanced periodontal disease. मतलब अगर किसी भी पेशेंट को पहले से पेरिकोरोनाइटिस या एडवांस्ड पेरियोडोंटल डिजीज है, then also it can lead to reduce incidence of dry socket in conjunction with antibacterial measures. मतलब जिन patients के antibacterial measures देखे गए थे, who were under antibacterial therapy, उनमें dry socket के cases कम दिखे. Presence of large number of bacilli and Vincent spirochete was introduced by Schroff and Bartel in 1929. This is just an extra information. Next, due to difficulty and trauma during surgery, the surgical extractions that involve the reflection of flap and sectioning of tooth with some degree of bone removal, right? मतलब ऐसा कोई भी extraction है जिसमें आप flap reflect कर ले हो, flap reflect कर रहे हो, and there is sectioning of the tooth. आप अगर पूरा tooth एक साथ नहीं निकाल रहे हो, you have planned a surgery which is going to fragment a tooth and you are going to remove the tooth in 2 or 3 parts. In that cases also it can lead to dry socket. Less experienced surgeons who cause excessive trauma, it can also lead to delayed wound healing, compression of bone lining the socket, thrombosis of underlying vessels, trauma with reduction in tissue resistance. Tissue की जो resistance है वो decrease हो जाएगी. जो भी inflammation है, जो भी factors है जिसको resist करने की resistance रहती है tissue की, that is going to decrease and there is going to be consecutive wound, delayed healing of consecutive wound, right? Then root and bone fragments remaining in the wound. As I said कि अगर कोई भी root fragments रह गई है या फिर कोई bone fragments is there in the root, it can also lead to dry socket. Excessive irrigation and curettage, if you do energetic and repeated irrigation of alveolus, that might interfere in the formation of clot and give rise to infection, right? Violent curettage might injure the alveolar bone. Also आप बहुत aggressively curettage करोगे तो bone को भी injury हो सकती है. Next, local blood perfusion and anesthesia. Vasoconstrictors in local anesthetic solutions have been suggested as alternative factor in pathogenesis. क्या कहा है कि whatever the vasoconstrictors are present in the local anesthetic solutions, they are again considered as an alternative factor which are leading to dry sockets. Patient who require repeated injection of local anesthetic solutions may have a reduced pain threshold. जिन patients का pain bear करने का threshold कम रहेगा, they will require repeated injections of local anesthesia, which may again account complaints of originating pain from the extraction socket. Again, increase in the incidence of dry socket when periodontal interligamentary injections. मतलब there are different types to give LA, right? You can give infiltration, you can give intraligamentary injection, you can give nerve block. So there are different types of blocks. So increased incidence is seen in cases of intraligamentary injections, mainly the periodontal ones. Next, moving on to those women who are taking oral contraceptive, it has been proposed that estrogen like pyrogens present in the contraceptive pill will activate the fibrinolytic system indirectly. क्या कर रहा है? Estrogen is going to activate the fibrinolytic system, that is fibrin को लाइस करने की सिस्टम, which is going to degrade your blood clot. उस सिस्टम को एक्टिवेट कौन करेगा? Estrogen, which is present in oral contraceptive. So Caterani et al, the probability of dry socket increases with increased estrogen dose in the oral contraceptives, and that fibrinolytic activity appears to be lowest on days 23rd to 28th of menstrual cycle. So for example, we can say that the fibrinolytic activity is going to decrease between 23rd to 28th day of menstrual cycle. So कभी भी अगर आपको कोई भी ऐसी woman है जिसका आपको extraction कर रहा है and you are fearing that dry socket may occur, then you can conduct the extraction between 23rd to 28th day of menstrual cycle. Next is smoking. Total of 400 surgically removed mandibular third molars, those who smoked a half packet of cigarettes per day, a 4 to 5 fold increase in dry socket compared to non-smoking patient. मतलब जो patient smoking कर रहे हैं, in them there is 4 to 5 times increase in the cases of dry socket compared to non-smokers. Incidence of dry socket is 40% among patients who smoked on the day of surgery or on the first post-operative day. मतलब extraction करवाने के बाद तुरंत जाके if they are going to do smoking, then there are higher chances that the patient may face the problem of dry socket. Next, moving on to the pathogenesis, the partial or complete lysis and destruction of blood clot was caused by tissue kinases liberated during inflammation. मतलब जो भी destruction हो रहा है blood clot का या fibrin का जो loss हो रहा है, that is due to kinases which are released due to inflammatory response by direct or indirect activation of plasminogen. So whenever plasminogen will be activated, it is going to liberate kinins and kinases which are going to lyse your blood clot. Next, moving on to the causes of pain. So here kinins are responsible, and for pathogenesis kinases are responsible. So presence and formation of kinin locally in the socket may lead to cause of pains. Kinin क्या करेंगे? They are going to activate the efferent nerves which may have already pre-sensitized by other inflammatory mediators. मतलब आपके जो एक्सट्रैक्शन साइट के आजू बाजू की जो efferent nerves है, they are going to be affected by this kinins, and this nerve might be pre-sensitized by other inflammatory mediators also. It is not necessary that it is only due to kinins, but agar after extraction you can say that these efferent nerves are already pre-sensitized, and then again kinins are again going to act and cause pain. What are the factors that influence the healing? फर्स्ट है इन्फेक्शन. अगर इन्फेक्शन ज्यादा रहेगा तो हीलिंग डिलेड हो जाएगी, इन्फेक्शन कम रहेगा तो हीलिंग जल्दी हो जाएगी. Size of the wound in the same way. Blood supply ज्यादा रहेगा तो healing जल्दी हो जाएगी, कम रहेगा तो healing late होगी. Resting of part मतलब उस part को rest दिया जाए appropriate, then foreign bodies which are going to get accumulated in that area, general condition of the patient. Next, lastly, moving on to the prophylactic management of dry socket. So with references, there are two types of management. First is a non-pharmacological management, and second is the pharmacological management. So the non-pharmacological management is use of good quality current post-operative radiographs. You should carefully plan the surgery. Good surgical principles use karo. Do not unnecessarily harm the tissue. Extraction should be performed with minimum amount of trauma. As I said, minimum tissue को harm करो, and maximum amount of care should be taken around the extraction site. Confirm presence of blood clot subsequent to extraction. You should confirm that there is formation of blood clot, then and then only you can leave the patient. Pre-operative oral hygiene measures you should take. Encourage, if the patient is smoker, you should encourage him to immediately stop smoking for a few days. Avoid vigorous mouth rinsing. That is what we advise in our colleges also, that do not gargle vigorously first 24 hours post extraction. This is the basic advice. Why is this given? Because it leads to dislodgement of blood clot, which may lead to dry socket. Next, moving on to, for patients taking oral contraceptive, extraction, as I said, should ideally be performed during the days of 23rd to 28th. And lastly, comprehensive pre and post-operative verbal instruction should also be given. Now, what are the pharmacological measures? So pharmacological measures include various types of drugs which you are going to prescribe depending upon the clinical scenario. It is not necessary that you prescribe each and every drug for the case of dry socket, because the etiology is multifactorial. The treatment is also going to be from different aspects. So firstly, the antibacterial agents. So prophylactic antibacterial agents which are induced systemically or locally, like penicillin, clindamycin, erythromycin, or metronidazole. Pre-operative administration of antibacterial agents is also seen more effective, right? A significant reduced incidence of dry socket following light socket irrigation. So you irrigate the socket with beta-D, and topical application of clindamycin is also helpful in decreasing the incidence of dry socket. Next, antiseptic and lavage. So chlorhexidine is a best biguanide, right? What is a chlorhexidine? It is a best biguanide antiseptic with antimicrobial properties. It prevents the infection. Along with that, it also kills the bacteria. Use of whitehead varnish, right? Whitehead varnish is a combination of iodoform, balsam, toluene, styrex liquid as a base liquid. Result is significant decrease in incidence of post-operative pain, hemorrhage, and swelling. So these three things are decreased. क्या क्या decrease हुआ? Post-operative pain, hemorrhage, and swelling. See, all this detailed information of treatment is for your understanding. It is not necessary to write each and everything in oral pathology, but yes, if this thing is asked in oral medicine or something, then you need to explain whole treatment plan. Next, alvogel has been widely used in the management of dry socket, and it is frequently mentioned in the literature, right? It contains butabem, which is an anesthetic which prevents pain. Eugenol is an analgesic which prevents pain. Butabem acts as an anesthetic, and iodoform acts as an antimicrobial agent. Topical use of para-hydroxybenzoic acid, PHBA, in extraction wounds acts as antifibrinolytic agents. What is antifibrinolytic agents? Which prevents the lysis of fibrin clot, right? The main problem is that the clot is getting dislodged. So what you have to do, just prevent the dislodgement of clot, and various factors also are necessary, right? Not only clot. Next, epernil and alveolar cone. It is a cone which is to be placed in the socket, which contains 32 milligram of acetyl salicylic acid, 3 gram of propyl ester of polyhydroxybenzoic acid, and 20 milligram of unknown tablet mass. So epernil is an alveolar cone which is going to be placed in the socket, which will promote the healing and prevent the formation of dry socket. Next, steroid and anti-inflammatory agents are going to help you prevent the inflammatory activity. You have obtudent dressings, which are immediate placement of eugenol containing dressing into the extraction socket. So whenever you carry out an extraction, you immediately place the eugenol containing dressing into the socket to prevent the post-operative complication. Use of clot supporting agents, which are going to support in the formation of clots, like polylactic acid was widely promoted as ultimate solution for preventing dry socket. Non-dressing management, like remove any suture to allow adequate exposure of extraction site. If there is any suture and which is to be removed, just remove it. Irrigate the socket with isotonic saline gently, not vigorously, and careful suctioning of all excess irrigation. Do not attempt to curate the socket. Prescription of potent oral analgesics which are necessary according to the patient. Patient is given with a plastic syringe which is having a curved tip which he can use in his house to again irrigate with a chlorhexidine solution. So this can be used as a home care remedy also. Surgical management, if you see, so under block anesthesia, sharp margins of bone are trimmed or they are rounded. If any foreign body is present, they are thoroughly removed. Detached gingival margins are also scalped. Desired medications are prescribed. Patient was not only without pain but also comfortable both physically as well as psychologically from very next day. So if you are following these criteria, you can see patient in this form also. Lastly, going with the conclusion, this was all about dry socket. If you guys have any doubt regarding this topic, please let us know in the comment section. Evidence suggests that it is most particularly related to a complex interaction. तीन चार चीजों की interaction है between excessive localized trauma to the extraction site, first point, bacterial invasion, second point, association to plasmin and subsequently fibrinolytic system, right? So these four things are mainly acting at the site of extraction. What did Hippocrates say? At first, do no harm. Prevention of dry socket entails reducing the number of possible risk factors. As I said, it is a multifactorial disorder, a multifactorial condition. So you need to evaluate each and every risk factor. You should provide adequate attention to the patient and his details and his habits. So this is all about dry socket. I hope you guys understood the topic. If you have any doubt, again, feel free to write in the comment box. Thank you.